My name is Kathy Higgins. I am a patient advocate for the Li-Fraumeni Syndrome Association. I have been friends with Harsha for many years, and he asked me to come to the summit and see how it worked. I lost 2 daughters to a rare disease, so I travel around the country advocating for our rare disease and rare disease in general. I met Harsha at an event in DC. We happened to sit and have lunch together one day, and he heard my story and we became friends. We're friends on Facebook and we've stayed friends. We've met up at different rare events over the years, and I just was with him in San Diego and he reminded me about this event coming up, so here I am. I found that having 13 international chapters around the world was something that I just said as a matter of fact, you know, just there it is on a map, but it really makes a difference. We do have a chapter in India, and it really makes our footprint of our organization a lot bigger than I realized it was. I took it for granted, and I won't take it for granted after this. What I'd like to do is investigate how to broaden our organization's interaction with pharma and industry and government. I've been concentrating on educating doctors and people, letting them know about our organization and our disease. And in this conference, I feel like we're missing a piece, and I need to do that more. So I'm going to go to NORD and I'm going to talk to them and figure out what my next step is to write a plan out to figure out how to broaden our reach within the rare disease space as a whole. We do not have any therapies. We are just, we become normal cancer patients once we get cancer. We have a lot of cancer in our organization, so there's no gene therapies. We're not working with a gene therapy company. We're not working with any pharma. We do have one research project going with elephants, because elephants have 40 copies of the cancer suppressor gene that humans have 2, and they don't get cancer. So we fund research with that, and we're doing a circulating tumor DNA study kind of thing. So, but we don't have any approved therapies or anything like that. I'm hoping that India does have an untapped base of researchers for us and our organization and rare disease in general. Cancer, being the p53 gene, is one of the most studied genes in the world, and so I'm hoping that expanding our footprint in other countries, and especially with the population in India, that we would be able to hopefully find more resources to help researchers grow and find a cure. I would ask the Indian researchers to realize that, I'm sure they know this, but we're not just petri dishes, that we're people, and every single day we're living with these things. So when you're looking at a petri dish or a cancer cell, if there's one thing in your mind that you say, geez, I remember seeing that lady's face, or that person lost 2 daughters, or a husband or a wife or whatever, that their work matters, and we're relying on them to save our lives. It really blew me away. I didn't know what to expect, especially with the connection of India and rare in the US. I wasn't sure what I was going to find, but I really, really enjoyed the conference very much. I thought it was run really well. I learned a lot of things, and it motivated me to take my advocacy to a whole new level by listening to other advocates and what they're doing. I was very pleased with how well it was run, and I was impressed with Harsha, and he's been a friend for a long time. I was overly impressed with how involved he is, how committed he is to the rare disease community, and just has a good vision for the future on where he wants things to go. And I'm honored to call him a friend, and I look forward to riding along on the journey with him.